Live from New York, it's Benefit with Friends. I'm your host, Lou Bernardi. Welcome on Thursday, May the 26th, the last Thursday of May. We have a great show for you today. For those of you that don't know me, I'm Lou Bernardi. I am a founder of a benefit agency here in Woodbury, New York. I am the Boo. I coined the phrase benefit optimization officer a while ago, and that's really what I think of myself as, rather than someone who just sells insurance, which I've done for about 28 years. So today, my guest Darrell Moon and I are going to talk about such a relevant topic. But since it's May and it's Mental Health Awareness Month, we're going to talk about that. We're going to talk about a lot of things. We'll talk about his company and organization that he started. So I'm going to bring Darrell right in to the stream. Welcome. Hey, Darrell, how are you?
Hey, I'm doing well. It's my pleasure to be with you today, Lou.
Awesome. Thank you. Thank you so much. We were talking a little while ago, and this I almost didn't pull this off today because I was at a conference the last 3 days in Austin, Texas, and thank goodness that we had both had it on our calendar. So I was like, let's get this going. Hopefully, there's some people out there. I'm real passionate about what we're doing here at Bright Path, and I know you're real passionate about Orriant and aspirational healthcare, which I want to get to both of those and how they can help employers and just people in general. Right? It's about people. So let me stop there and let you introduce yourself to the audience.
Great. So again, my name is Darrell Moon, and I started off as a hospital administrator and had the opportunity to run 10 different hospitals across the country, but I became very disillusioned with the healthcare system that was not built around the customer. And so I left the healthcare treatment side to really, I opened 3 brand new hospitals. And so instead of building hospitals at the bottom of the cliff, it's about how do we put fences at the top of the cliff so people don't fall off and need the hospital in the first place. And so Orriant, which is a term that's a Latin term that means to rise up and be happy, is about helping people to win the battles inside, change behavior to live more healthy, to really maximize life and live life to its fullest. That's what we do.
That's amazing. And it's so easy to do, right?
It's the hardest thing there is to do.
It is very hard, everybody, there's not a person out there, if there is, please call me, email me, but everybody has challenges. Life, even from the outside, you can look at people and say, wow, they have everything. Maybe
got it all put together. Yeah.
And they're all very, the ones that have so much materialistic stuff often are probably the people with the most voids in their life, right? It's not always the case for sure, but right. It's it's crazy. As I mentioned, I just got back from Austin, Texas, and there were a lot of companies at this Benefits Pro conference. Shout out to Josh Butler. He won Benefit Broker of the Year. Great guy. I've known him for quite a while. But there were a lot of, I would call them vendors or solution partners, trying to get the attention of a couple of hundred advisors, maybe several hundred advisors that were there. And I got to tell you, probably 1 out of every 3 was, wellness or behavioral health focused, which is good to see. They're all very different, right? There's not a great all-inclusive solution, probably, unless you disagree with me. You're the expert, by the way, in this compared to me. So I'm a benefit advisor. We don't do a tremendous amount of wellness because I feel like it is something that I don't want to sell a product because one product just isn't right for every employer, every industry, every type of employee. But we do have probably a few companies that I'll, if asked, make recommendations or draw awareness to. Is it something that you've seen evolve, and is it evolving for the better, the type of resources that are out there?
So I hate to be too critical of my own industry, but let's kind of say what it is.
Yeah.
Most wellness, and have for the last 20 years, been mostly about handing people incentives to do simple tasks. We don't have a problem in this country of people not doing simple tasks. what we have a problem in this country is people living healthy.
Right.
And that is an incredibly difficult thing. And you will never accomplish moving population health by simply handing people rewards to do simple tasks like go to a health fair or to, participate in a competition or to simply, track their walking steps for a while, or, little things like that are just task oriented, that I get a reward to do a task alone will never be sufficient to drive population change. And so what we've discovered is, although yes, there's a value and a place for using incentives to get people to do simple tasks, the most important simple task is to drive a lot of people into a relationship with a third-party accountability partner who supports them in doing the hardest thing there is to do, which is making change. Right. And so all the wellness technology and all the wellness fun and flair has really little impact on population health. But if you can drive a majority of your population into an ongoing, trusting, long-term relationship with someone who's not going to tell you what to do, but simply help you win your own battles inside, you will drive change, which will in turn drive population health.
Right. Wow. When I think of population health, I think, of the physical aspect of it. Right. But it's not exclusive to the United States, obviously, but there's a lot of stresses, right? Stresses come from all different aspects of life. It's family, it's financial, it's work, it's your health. I mean, I think most people, I know I'm guilty of this. I tend to spend a lot of time helping those I love and rather than myself a lot of the time, right? I wake up every day and said, boy, I wish I had taken better care of myself. Boy, I wish I had done that. And then in other ways, I feel like, wow, I did so many other things right. And I don't even know why. I don't know what that was that made me, I'm in the industry 30 years, but I'm also going to be married 30 years this year. My oldest will be 30. I have a 25-year-old. And, there were a lot of people at this conference that were very open, right? A lot of people on stage talking about these topics, and they were, saying, hey, if I could have done it over again, I would have done this. I would have been at the game. I would have been at the dance. I would have been there for events. I was successful in the eyes of so many people, but it was so one-sided, right? And it's just that it's getting that balance, right? I could say, I look back, I say, as a father, I would do very few things differently, right? I was there. I made some really good decisions, but it's time for me to start taking care of myself also, right? Just physically, mentally, I think I'm okay, but that changes day to day as well.
There's something very valuable about having someone that's outside of yourself that you touch base with on a regular basis on how you're doing at reaching your goals, right? Whether it is about being a father, whether it's about your job, or whether it's about finances or your physical health. But having someone who's not there to tell you what to do, but simply help you reach your goals, right, by knowing you're working on them and you can touch base, is an incredibly powerful thing.
Yeah, keeping you on
task.
You're going to get off, but if you have that person that you're accountable to, that you trust, that you're not going to just BS and say, oh yeah, I'm doing great, I'm eating well, or I did this, or I'm home for dinner more, whatever it is, you have to be honest, right? And if you could find someone like that, so how do you do that? How have you found is the best way to do that? Is it through technology? Is it through
well, it's really nothing fancy. Again, people will do simple tasks for incentives,
right?
So by simply delivering an incentive to have the relationship, brings people to the relationship, doesn't change behavior, but it's the relationship that changes behavior. So you could be completely technology free, other than maybe a phone call to call and talk to the coach or that third party accountability partner.
Right.
I've managed population mental health now I've either run psychiatric hospitals or managed population mental health for almost 40 years.
Wow.
And there's probably some really important key principles that we've learned, but nothing more important than you got to get upstream. You can't wait till somebody needs a crisis line to provide this really cool, wonderful mental health solution.
Right.
And the best way to do that is to really offer an entire support resource and service that supports people from ever getting downstream in the first place. Right. And, you and I have talked about the amazing healthcare system in Alaska called the NUCA system. Yeah. They literally built the entire healthcare system around mental wellness and behavioral health. And they build it by creating relationships with every single member, with someone whose first and foremost role is to influence them to accomplish their goals and meet their passions, do what they want to do, live life to its fullest. Right. And it's amazing how now 20 years later, after building an entire healthcare system around that concept, it's the best healthcare system in the world. Has the best outcomes, lowest cost.
And what prompted them to do that? Was it something that they were not worst in the country, but was it so out of control that some person finally said, we need to do something about this and we have to be purposeful about it?
Interestingly enough, it was the government who said, we offer the Native Americans healthcare through the treaties, but we recognize that the federal Indian healthcare services system has its imperfections. Right. And so if any Native American group of tribes would like to take over healthcare from us, we will let that happen. And this 190 tribes of Native Alaskans in Alaska, South Central Foundation said, look, it couldn't be any worse than it already is. We have one of the worst population health groups in the world. I mean, our health is terrible. The healthcare system is terrible. Let's take the government up on their offer and let's create our own. And then they did something that nobody else has ever done to create a healthcare system. They literally spent 4 to 6 months massively asking their customers what they wanted from a healthcare system.
Right.
And surprisingly, what they heard was, we don't want a paternalistic system that tells us what to do. We want a healthcare system that partners with us through our journey through life to help us live life to its fullest. You know, if you were to ask anybody, is your current health status because of you or the healthcare system? Like, how much of your current health was done to you by the healthcare system? And how much of your current health was because of what you did to yourself? Most people would have to agree that, well, it's what I did to myself.
Sure.
So all they did was they said, well, what if we balanced the resources of the healthcare system on the needs of the customer, right, and actually put a tremendous amount of resources in supporting people in that part of their health, in actually accomplishing health that they have to work on. And yeah, we need to have tertiary care. We need to have hospitals and surgeries when people fall off the cliff. But what if our first and foremost focus was in helping people live life to its fullest and enjoying life with good health?
Well, so now, just to be clear, we're not talking about the insurance solution. We're talking about the healthcare system,
the entire system,
the clinicians, the practitioners, and everything. So how did they do that? Did they do it through education? Did they do it in the school systems at an early age to get an early start and help people understand that the decisions they make starting very early have a significant impact later on?
What they did is the design of their system is so simple and yet so brilliant. They created a massively powerful primary care system of healthcare. And they said, we're going to take a small number of our members. So we have 65,000 members. We're going to break them up into lots of these little groups. And we're going to assign every group to a team. That team's going to consist of a doctor, like a primary care doctor, right, a nurse who case manages things, a medical assistant, and a scheduler. And we're going to turn all of those 4 people into amazing coaches. Coaching is going to be their primary role. And we're going to ask them to proactively reach out to all of their members before they need healthcare and actually build a trusting relationship through what they call storytelling. Everybody has a story. So let's build a relationship of trust so that we can influence you to live life to its fullest. So we can be that partner that journeys with you. But also when you need us, we're a phone call away. I mean, you literally have access to all the healthcare you need immediately because all your healthcare goes through this team. And whether you have to see a specialist or a secondary provider or a hospital, it all gets coordinated by your team who you're journeying life with to live life to its fullest.
Wow. You know,
it's a pretty simple design.
It is. And I think oftentimes just comparing that, what I'm hearing is, I didn't hear insurance at all, right? I think insurance gets in the way a lot of times. People think of their healthcare as their insurance carrier, right? And the boundaries that those carriers provide, right? And there's a real significant, I think I mentioned to you the last time we spoke, I'm still writing my book. You know, it's changed and evolved so many times because I'm still learning. I mean, after 30 years, I'm learning so much about, you know, what can be done. I want it to be right. And I have to just trust myself. It's never, I'll have to write a second book probably to critique my first one. But there is such a significant shortage in this country of primary care doctors and managed care fee for service system, whether deliberately or unintentionally, has made them extinct. People do not have primary care doctors. My wife, Jackie, went to see hers today, but she had to wait 2.5 months to get in.
Really?
To get into the doctor. And she couldn't, you know, I mean, people are starting to use urgent care as their primary care doctors. And that has its, you know, they're great doctors, they're ER doctors, you know, but it's more expensive. And you don't have a relationship that you're not going to see the same person every time you go there. And that's the problem. There's no relationship. When I was born in Brooklyn, New York, Dr. Zimmerman, I'm pretty sure that's his name. And I don't remember many names, but I remember him. He lived on our corner.
Yeah.
And every single day when you were outside, because we played outside every day, we played Skelsy and stickball. He was walking the neighborhood every single day with his leather case. He knew everybody. Everybody knew him. Yep. Everybody stopped and waved to him.
And that was actually a brilliant design. And all Nuka did was said, let's bring that back.
Yeah.
Let's literally create a relationship-based healthcare system. I mean, because if anybody has a family member who's a doctor, who do you call? You call your family member, whether it's your dad or your uncle or your cousin, and you say, look, here's what's going on. What should I do? Well, that's not the majority of Americans that have access to that.
Right.
So I'm a big fan of subscription-based primary care, where you just simply pay a membership every month that goes directly to a doctor who now has every alignment to keep you healthy. Because they're not billing based on how many times you get sick. They're just getting a certain amount of money from all their members. And now they want to keep you healthy.
Right.
They're doing everything they can to help you, encourage you, support you to be healthy.
Well, I talk about that often on the show because direct primary care, which is what you're referring to, in some parts of the country is very robust. It's growing very quickly. Here in New York, there's literally one full-time direct primary care doctor on Long Island.
That's amazing that there's only one.
There's one, Dr. Blyskill. I don't think she's watching the show. She's busy. But I signed my daughter up for her. I was at a conference in Phoenix a few months ago, and I'm sitting there listening to the direct primary care doctors. Probably the 20th time I've sat through one of these presentations. And every time I do, I think, man, if everybody could have access to that.
Yep.
And I got up and said, what am I doing? Why haven't I called her for my daughter? Because my daughter has some health things we're trying to get on top of. And it's been a 12-year journey of 7-minute appointments. No
with
one
lots
really
of different specialists.
Yeah, specialists and just medication after medication after medication and increase it. Yep. No one knew her.
Yep.
Even the doctors judged her for what was going on. It had to be her. And we finally signed up, and I went there on the first appointment and introduced myself and said, Dr. Blyskill, I've been trying to contact you for about 2 years. I wanted to talk to you to figure out why you? Like, what made you make this decision? What gave you the courage? What gave you the, and it's not easy to do either. You have to have
Yeah.
the finances, and, too often doctors have so much debt and they get buried into this system where they feel like they can't get out. And, but it was amazing. It was an hour appointment, partially with me in the room, a lot of it without me in the room, because she's there for my daughter. That's
Right.
her patient. But in the first week, they interacted about 12 times.
Wow.
By Skype, by text, and she took over every medication prescription. Like, it was unbelievable. And I am sure, and you're very familiar with the Forbes Business Council, and I became a member after speaking to you about it. And I was on a call last month or the month before, when I brought up the topic of direct primary care. All these bankers and financial people were on the call, and all of a sudden they got so interested. They like, tell me about that. What is that? Because they see so much money, private equity money, moving in that direction, which could be good or bad, but it's at least a means to expand that type of offering greatly. There's a fine line. Private equity wants to make money, so there is that financial motive. But I think at its core, because they don't work with insurance companies, because they're not incentivized to see you more, to earn more, they're truly going to be there for you. So I'm really excited about that. So,
and that this aspirational healthcare model that we're moving across the country and trying to promote, that is healthcare built around the customer, is all about getting employers to simply spend their money differently. And they can literally spend their money less and get a much better product to attract and retain top talent if they just get out of the paradigms that they've been in for so long.
Well, they think they're buying insurance, right? They've been doing that for 25 years. Their insurer, their broker comes to them. Here's your increase. Your premium's going up. And there's comfort for the benefit decision makers that they don't have to think about health insurance for 9 months out of the year. So they want to get it done. And too often the people that they trust haven't seen under the hood of healthcare and health insurance. And that's 5 years ago. That's what caused me to change the entire trajectory of my career. I saw it, and I was very upset, because I feel like I felt like I was a great insurance broker. I was doing great things. I was able to help businesses manage their premiums without making significant benefit changes. And I thought, wow, I'm special, but I wasn't special, because there's so much artificial cost. There's so much manipulation of the prices. There's such a
misalignment.
The misalignment in the whole system, insurance and healthcare, simply wants to suck as much money out of American businesses and their employees as possible. But they have to do it at least under the narrative that they are actually the do-gooders,
Which makes it really difficult to criticize this big broken system, because, they do represent caring for people.
Yeah.
But I was in the belly of the beast. I ran 10 different hospitals. And literally, when I really looked at the entire industry and who the customer of the industry was, who's actually buying the healthcare industry, is like, I literally work every day against my customer.
Right.
How is it that the largest industry in America can get away with me at the top of the food chain working not for my customer, but literally working against my customer?
Right.
And I finally said, I can't spend the rest of my career working against my customer.
You know what? Once you have that revelation, which is what I had too, you're one of two types of people. Well, three types of people. Okay, too bad, I'm making a lot of money. Or I don't have another choice, so I'm going to go back to doing it that way. Or I have to be part of the change.
Right.
So I wanted to talk a little bit about the Orriant and how because I was so interested when I learned about it, and I became an aspirational healthcare advisor, how you measure those four different aspects of the healthcare or health insurance, help employers attract and retain the top talent, and make sure that their investment that they're making in their people, which is their second or third biggest investment, is actually working for them.
Well, again, the term Orriant means to rise up and be happy. And
Right.
so it became very apparent to me after running hospitals that we're not really building something for the customer. And often the one who buys healthcare is the employer. I
Right.
mean, they're the ones that's payrolling this healthcare industry, other than Uncle Sam.
Yeah.
And so I had the opportunity a number of years ago to be a speaker for one of the largest CEO organizations called Vistage.
Right.
And I've done almost 100 presentations across the country to over 1,000 CEOs. And I love to ask CEOs this question. What do you want? Why are you buying healthcare? And they look at me and the first thing they say is, because I have to. It's like, I have to keep up with the Joneses. If everybody else is offering insurance, in order for me to hire people, I got to do it too. And I say, I got you for 3 hours. I think you can do a little better than that.
Right.
Literally think about it. What do you want as the one who's payrolling this huge industry? And they almost always, without exception, say the following 4 things in this order. I do it to attract and retain top talent. I'm willing to spend this money, and sometimes my second largest cost of doing business, to attract and retain top talent.
Right. My
customers are happier. My product and service is better when my employees are healthy and happy and productive. So I want healthy, happy, and productive employees. That's what I want. I want my employees happy with the healthcare system, that when they interact with it, they feel like it's good quality care. And finally, they wish it were more affordable. And then I love to ask them, okay, that's what you want. Does your CFO get a bonus if you get what you want, profitability? Yeah. Does your salespeople get revenue or bonuses and commissions when you get what you want, which is revenue? Yeah. Have you ever bonused, incented, or even recognized the people you put in charge of your second largest cost of doing business to bring you the 4 things you just said you wanted? And they always look at me and go, no, I don't do that. And I say, therein lies the heart and soul of why our healthcare system is so misaligned. You, the buyer, do nothing to align the system to give you what you want. And so we've produced, for people like yourself and others who want to use it, just some simple surveys where you ask the employees, how well did the benefits that your employer offer you attract you to come work here? Was it a part of that decision? And now, more importantly, how critical is it to you staying? How does it compare against pay or culture? Do the benefits your employer offer play a role? And to what degree is it playing a role in helping you stay there? And we ask them, are you satisfied with the healthcare system? Do you like it? Do you feel like it's good quality care? We ask them things like your health, and we monitor from year to year how well their health is improving and changing. And affordability is really easy to measure. Did your cost per employee go up or go down? But employers look at that, but they never measure those other 3 areas. So we've just simply created some very easy to use, no cost monitors that allow employers to simply measure whether they're getting what they want in the first place.
I could imagine at this moment, if there's an audience out there live or when they watch this and they're busy at their desk doing something and you just said no cost, right? And just like, what? Like how, as you're saying these things, and the last time we spoke too, I'm thinking to myself, they don't do it because they don't even know it's possible.
Exactly. They've never thought about it before.
They've been on autopilot. Every single person that I speak to, some really bright people in the talent acquisition world, right? People that work with huge companies, people that work with startups. When I have conversations with them, they think, well, benefits, they're not even important. And I said, I completely disagree.
You're spending a lot of money on something that's not important.
It's it doesn't matter what we offer. I said, well, hold on. Let's pretend you're looking for a job, or you have a job and you're a little dissatisfied for whatever reason. And you go on one of the more, I don't like to give advertising. So a popular job search website and you see an opportunity and you give them a call and it's similar pay, similar hours, all of the things, all check off all the things, you want to work in person, you want to work remote, all of these things. And you get to benefits and you currently have a plan with a high deductible, pretty significant out of pocket versus a company that's doing it a little bit differently, right? Just with different, more aligned partners that has potentially no out of pocket.
Yeah.
Lower.
And in many cases, no cost to the employee.
Exactly.
Let me offer you a benefit that you don't have to pay anything for, and it's focused on you.
It's so contrary to conventional thinking, right? And part of my book is the fact that we've been groomed by the healthcare and the health insurance industry. We have literally, I'm not pointing fingers. They're for-profit companies in a capitalistic country, but there is no doubt that both ecosystems, healthcare and health insurance, have deliberately kept the consumer in the dark when it comes to quality, cost, and the price of healthcare, right? Cost of healthcare is, what does it actually cost? I'll give you an example, and you've probably seen this. Because most of the doctors out there, the primary care doctors, have been convinced to join the healthcare networks, the healthcare systems, become an employee of the healthcare system to unload a lot of the financial admin responsibilities so that they think, I can finally go back to being a doctor, to find out their new boss has some pretty significant requirements on them and they have to see a patient every 7 minutes, right? Those doctors are the gatekeepers. It was so crucial for the healthcare systems to go downstream to get the doctors on their team.
That's why we did it. Yeah.
Right?
As hospitals, we bought up those primary care practices to be a funnel source into our system.
There's no question, right? And not just in the system, in my opinion, and you're the perfect person to maybe confirm this or deny it, to refer people to where the care makes the system the most profit. So when you need an MRI, your doctor who works for the healthcare system doesn't make the decision anymore of where you're referred to. He pulls out a piece of paper for MRIs, for scans, for whatever tests here. And all of the facilities on that list are also participating in the system. And it's typically where they make the most money. They even convince people you have to go there. You don't have the choice to go to the independent radiologist next door. I have one next door to my building here, where it might be $600. And if I pay cash, it might be $400.
Yeah, $300.
So
as a hospital administrator, our whole job was whether I worked for a for-profit or a not-for-profit, because it really wasn't any different.
No.
My whole job was to maximize the bottom line of the hospital.
Right.
And so it's like, okay, doctors who I'm trying to attract, to recruit, to make sure they admit to our hospital, and those who I give positions to, like medical director or department director, it's, are you meeting your quotas? Are we getting is the cath lab full? Are we getting the things we need in the various departments? Are we getting what we're measuring the wrong thing? We're never measuring whether the employer is getting what they want.
Right.
The customer, we're simply measuring whether we're getting what we want. And we want patients to have a good experience. We want to have good outcomes.
Of course. Oh, yeah.
But we're not focused on the real customer who's buying our service at all.
Well, that's the thing is, and I'm very clear, doctors are great people. They're part of the problem. Brokers are great people, but they're part of the problem because they're part of the system.
In many cases, the doctors, like you said, I loved how you described that, because of the situation they're in. They've been bought up by the system, and there's so many, even primary care, there's so many RVUs they have to hit every day. If they haven't hit their relative value units, which means the number of patients they see or the number of procedures they're literally, they're monitored by their RVUs. Mm-hmm. And to make a half the salary that their specialist colleagues are making, they've got to hit those numbers. And so their world is built around these measurements that aren't about, are we taking care of patients? Are we keeping healthy people healthy? They're about the number of procedures that are driving fee-for-service revenues that we can bill the insurance and get paid for.
And get them out of the primary care silo as quickly as possible and get them upstream.
Yep.
Right? boy, it's going to be easy to fix, right? It's going to be.
Well, the thing that's interesting is I believe it is easy to fix. And I think it's all about how employers spend their money.
Right.
Like you just said, they're so used to the traditional, oh, I need to go buy an insurance plan for my employees, and I need to leave it at that.
Right.
And as long as I give them an insurance plan, and they're caught up in this philosophy of if it's not good for everyone, it must not be good for anyone. And that little philosophy has just put a noose around the neck of business for 60 years. When in fact, there are alternative ways to pay for healthcare that most of your employees would be much better suited for that aren't the traditional insurance mechanisms to pay for healthcare. But because we're so caught up in, I got a broker, they bring me bids, I choose a carrier or couple, I give them so many options to choose within that realm, that we're missing the opportunity to save 20 to 50% of our total cost by just using a defined contribution and saying, I'm going to put money into 4 buckets.
Right.
One will be for those catastrophic care, medical care. One will be for primary care, for an aligned subscription-based primary care. And if you don't have one, you don't get the money.
Right.
It's not like you get to take this one bucket and spread it across. No. The only way you get this money is to have a different relationship with the front door to healthcare.
Right.
And then a separate set of money that's an incentive to work with a third-party accountability partner like a coach. And the fourth money should go into a bucket that allows the employee to choose what they want to do with it.
Right.
These new EBHRAs are like opening the door to employers like never before in terms of options, where employees can say, hey, I want to use that money to go towards a certain premium for dental or vision or supplemental or long-term, or no, I want that money going into a cash account to pay for medical expenses. And all these alternative healthcare options I want to take advantage of, I can use it for that.
Right.
Giving the individual the choice of how to use the employer's money. And so the aspirational model is simply stop being in the middle of the decision.
Mm-hmm.
Give your people money into separate buckets and let them choose what works best for their family, and let you and them save tremendous amounts of money.
Right. So I always tell people, the motivation isn't the money. It's just that when you do it the right way, when you do it with aligned partners, you can't help but save money because we're eliminating the hidden profits. We're educating the member, we're educating the employer and saying, I get called and I meet with HR directors, and sometimes CFOs, CEOs are there. And I go through a presentation and I say all the time, it is a complicated conversation, but the solutions are pretty simple. But you have to get through the conversation, and people aren't prepared for the truth. They claim they want outside the box thinking. Right? Well, I don't love that term because that could just be something a little crazy. Impactful solutions based on actionable data is really what you need, right? Yeah. So we have some clients that are doing amazing. And it's funny because we've made some shifts with some of our clients into the independent TPA, independent pharmacy benefit solutions, right? Because we knew, especially in pharmacy, as much as 50%, price variance between a pass-through PBM versus the insurance carrier embedded, PBMs. But one of the things I think was so important is we have a real clinical case management company that we've selected. It's not the insurance carrier, and not to be confused with pre-authorization, right? So we're still using networks. Reference-based pricing is phase 2 or 3 of a lot of our plans. We don't have to go that far. We're just trying to get them back on course and then implement the solutions, that are appropriate for where we are, our demographics. Here in Long Island, we don't have access to the direct primary care like other states. But one of the things that we do is we are, with this clinical case management company, mining the data, looking for people, as you mentioned before they need a surgery, before they go. Because A keen eye, not my eye, a keen eye can see the trajectory that someone's on. Someone who's, pre-diabetic or insulin resistance, they can see it. We can see who's being prescribed medications but not filling them. And
Which is why a relationship-based healthcare system makes all the sense in the world.
Right.
When the folks up in Alaska said, hey, let's make your first priority to get to know each of your members and build a trusting relationship. Now you know early how to best intervene, and they trust you, so they call you early.
Right.
It's like getting involved early and then coordinating the care is the key. And it's not based on, I have an app or I have a technology that will bring up a telemedicine physician. It's having a trusting relationship.
Right. We see the emails when after this happens, because they'll reach out to us and say, we feel it would be really beneficial to reach out to John Doe. Can you please provide us with contact information? And we do that. We let the HR person know it. And we try to get to the HR person before the reach out to let them know, can you please let John or Jane Doe know that they're going to be receiving a call or an email or a text or something from this nurse. Amazing, very, very talented, company nurse. And sometimes we don't get to them first. So an email or a phone call goes to the HR director saying, is this legit? Because this never happened before when we had so-and-so book a company.
Right.
And I said, that's because there's no incentive for the insurance carrier to do that.
Yeah.
They don't, right? There's not an incentive. When I think of aspirational healthcare and I think about Bright Path, what we're doing here, that's our strategy. That's our name. I think what we're doing is we're doing everything an insurance carrier does today, plus all the things they should do, but don't, because there's no financial incentive for them to do it. They don't want to control costs. Their stock prices will go down. People don't understand that. They're motivated financially. It really is very disturbing.
Most people think that the insurance companies out there is the watchdog of this broken healthcare system. And it's a good thing I've got one of these big insurance companies protecting me. What they don't realize is that the only way for insurance companies to keep increasing their profits and their shareholders' earnings is for healthcare costs to go up.
Yeah. When you look at the top of the... Oh, go ahead.
In your example of, having a nurse reach out to someone, imagine if 75% of all those employees already had a relationship with a health coach or a primary care physician where they're already having ongoing proactive conversations on keeping people healthy. And now someone needs to reach out. It's like, oh, we don't even have to go through HR.
Right.
We don't even have to let HR know because there's already a relationship-based healthcare system in place. We just go through that relationship-based healthcare system.
It's every step of the way. It's about that relationship. The pharmacy benefit managers in our style of plans, they call us and say, same thing. Hey, they let us know, right? They want to let us know. They want to let the HR person know, so we can, again, let the member know this is normal. This is the new normal. People are looking out for you. And they'll say, hey, we noticed that Jane Doe is taking 8 medications, and a few of the ones that they're taking are tier 2, tier 3 medications. There's an alternative available. They've been taking it for so long. Would you be okay with us reaching out to the member and potentially reaching out to their provider, the subscriber of the medication, on behalf of the member with the member's authorization? Would you mind if we speak to your doctor and see maybe we can come up with a different combination of medications that will be better for you? Because maybe there's some, I don't know the terminology, but medications that are contradictory to each other that maybe shouldn't be getting medication from so many different providers. Sometimes they counteract with each other. And people are looking, and it's so rewarding for us. And, I when I was out in Austin, I said, I would love to be on all these calls. I would love to hear the reaction of the member that hears, well, instead of your procedure being done as an outpatient at the hospital, that's going to be $7,500 out of pocket for you because of the setting. we want to make you aware of an alternative where we can give you that same injectable medication at your home by a registered nurse or a physician's assistant, a qualified person at your home, and it'll cost you nothing. Right? And it's just
well, and my vision of the future is like Nuka. There's no need to be calling anybody because
Right.
it's already built in.
It's built into the product, right?
In other words, we're not having to counteract the broken system
Right.
by reaching out to someone and helping them. It's literally the way the system is all aligned in the first place.
Right? Yeah, absolutely. And what a beautiful! I believe it's coming. It's going to take a while to get from where we are today. We need more people like you who are willing to stand up against, the status quo. We need more advisors. We need to go from 1,000 advisors to 20,000 advisors.
Yep.
Right.
And employers who are willing to look outside the paradigm.
Yeah. Well, that's the thing is, that's the biggest stumbling block. I can't do it for them.
I know.
Right. They can't do it for their employees. It's getting them to say, I use Columbus as an example. I feel sometimes like I'm standing on the shore.
There's a land over there.
Over on the east side of the Atlantic somewhere saying, hey, anybody want to take a ride with me? We're going to go this way because I'm pretty sure the world is round. I'm pretty certain the world is round. And most people like, I'll take the next trip. When you get back, I'll take the next trip.
Let's go let you figure it out first.
It's really amazing. So, getting back to the topic of mental health, because I know that you're pretty passionate about that, and it's the end of May, so this will be our last show of May that can talk about it. Is there anything that you've learned through your 40-year career that I think when I talk to employers, they all like to do something, but feel helpless in doing it, right?
There is something. Yeah. Right. The most important thing is to recognize that the stigma is not going away.
Right.
It's not going to just because we want it to just go away tomorrow. And so instead of trying to work through the stigma, you simply work around the stigma. Mm-hmm. One of the most successful things that we've discovered is by using a non-mental health survey, monitor, tracker, and a non-mental health interventionist, we can get people in early to the mental health they need.
Right.
So instead of saying, I'm going to send all my employees a mental health survey and kind of figure out where they are and find out who's really in big trouble, and then proactively send someone to them, you say, no. What if we were monitoring the entire population in their overall well-being? And I'll tell you a real quick story. So one of the large department stores a number of years ago decided to put a happiness survey on the time card machine for every employee across the world. Before they could do their time card, they had to push a series of buttons on a box above the time card machine. Right. And it was a sad face and a bunch of faces until it was a happy face. And they just simply needed to pick which one applies to you today. And then there was a button that says, I don't want to tell. But because every day, hundreds of thousands of employees across the world are simply pushing buttons saying, this is where I am today, it was an incredible monitor to find which stores were having the most trouble, which areas of the country were having the most challenging economic or social or political type problems. And it became an incredible monitor to say, where do we need to intervene to fix departments or even to fix whole stores or to provide some resources? So having a monitor that can be very easily accessed by the population, not because they open an app, but because literally there's something like a text that comes and they can within 10 seconds say, this is how I'm doing. And then that monitor becomes an incredible resource to reach out to those who may already have a relationship with a third-party accountability partner or may have someone reach out to them to not be, I'm a psychologist, let me address your mental problems. I'm simply a life coach or a health coach or a success coach, simply reaching out to see how I can help with whatever the issues are. I noticed, that you're scoring poor in your job, that you're saying occupational well-being is kind of down. well, my employer isn't really recognizing me. I feel like I'm doing a lot more than what I'm getting paid for. Well, then let's have a conversation of how you address that with your employer. So little simple ways to monitor the overall well-being of a population, and then intervening with a non-mental health professional who could be then a catalyst,
right,
at getting people over the stigma hurdle and getting into someone early is the most important thing we've discovered.
When you do the surveys, right? And we talked about it earlier, so people come and go. But when you offer these surveys to an employer, how do you maximize the number of employees who actually do them?
It's back to the very first thing we talked about when we started the podcast. People do simple tasks for incentives.
Mm-hmm.
Taking 10 seconds to complete a texted survey is a simple task.
Right.
And you can drive tremendous utilization of that by simply either recognition or giving simple incentives for people to do that. But the value, just like in the case of this department store, you couldn't do your time card if you wouldn't say one of those buttons. You don't even get to start the day. So having some kind of an infrastructure that says it's easy, but there's also an incentive for me by doing it, that's easy. That's really quite easy.
Right.
Then you start to monitor where are the populations that are struggling and where are they struggling early upstream.
And so are these a series of interactions with employees, not just
so in most cases, we send out a text every week to everyone that's opted in to get text messages. And within 10 seconds, they can simply score how they're doing in each of the 8 categories of well-being: financial, environmental, intellectual, physical, nutritional, emotional, mental. It's easy for them to just simply say, here's where I am today.
Mm-hmm.
And when they know by simply doing that little survey, they're chalking $1 somewhere, that there's some incentive that they're getting, or they're reaching certain, they're doing it so many times a month or so many times in a 6-month period. That's all it takes to get high levels of participation.
Right.
Because then they can open an app and see, oh, gee, this is how I've been doing over the last 6 months.
Right.
They can see their own trends, their own scores, but it gives the system information that's incredibly valuable, that allows us to do things through the front of the car rather than always looking through the rear view mirror and saying, okay, claims say that someone's having problems here, so now let's reach out and do what we can do. Right. It's like, that's too late. That's the back. That's the rear view mirror. We got to be looking at the front of the car.
So you introduced me. You didn't know it, but when we were on some calls with the Aspirational Healthcare and maybe some other times we spoke, you were referring to CQI. And I was like, what is CQI? I wrote it down and I can't stop talking about it, right? Because continuous quality improvement, right? You're not going to go from 0 to 100. You're not going to make all the fixes if you even try to. And I realized it's like, wow, it's so applicable to business just in general, but to the way we do things.
Yep.
We talk about so many different things. I literally have access to 2,000 solution partners through the Health Rosetta. I'll never use all of them, but they're there. They're on the ready. So what we're doing is I say, okay, here's the core things that we can do that are not disruptive. We need to make these changes. These are the really monumental things that are driving up the healthcare costs, the health insurance premiums. And if we just eliminate them, we can reset you back to a much better starting point. But we're not done there. Now it's looking at the data just the same way I think that you're talking about doing it. You look at the data and say, this is the next list of appropriate changes. Let's do 1 or 2 of them this year.
Yep.
Right? You don't want to do all of them because sometimes they're related to each other. Sometimes if you make this change, you might fix 2 or 3 other things. I think when I think about...
Well, and the grandfather of CQI, Edwards Deming, put it so simply. Who's your customer? What's going to delight your customer? Are you measuring and monitoring on a regular basis the processes that delight your customer? And when you see variance in those processes, you're getting the teams closest to the process to improve the process to take out the variance. It's that simple.
Right.
Because you can make changes in irrelevant areas all day long. What's important is you should be monitoring and making improvements in those processes that do the most to delight the customer.
Right. You know, when I started this new journey, right, I say all the time, it took me 30 years to get 5 years experience. I didn't make the connection between healthcare and health insurance. I mean, it was always there. I knew it was about healthcare and the deductibles and the out-of-pocket costs, but I wasn't conscious because just like the employer, I had no access to the data.
Mm-hmm.
But now we know how powerful that data is, and there's legislation, I'm sure you know, that mandates the release of data, right? And employers are going to have some responsibilities making sure that that's available to their members, right? They need to know what something's going to cost them based on whoever their particular, network, or if it's RBP, reference-based pricing. What's it going to cost me? What do doctors charge for it? What's it going to actually cost me today based on where I am with my accumulator? How much deductible? How much coinsurance? Is it a copay? It is really going to empower the consumer. And in my book, which is probably going to be titled something like, Awakening the American Healthcare Consumer, or Reawakening the American Healthcare Consumer, we just assumed that we can't be consumers in this arena. So we gave up.
We gave up.
They won. They won. The more people that open their eyes and say, wow, I think about office products. Businesses buy computers, paper clips, Post-it notes, things like that. I'll bet you the COO, CEO, CFO, somebody can call someone into the office and say, what is our unit cost for this? And some competitor can come in and say, I'll do it for 5 cents cheaper. Some things within the healthcare system are a commodity. Other things, it shouldn't be about saving money, but about getting the best care.
Which often saves you money.
Which does save you money. That's the thing. When I think about some of the centers of excellence in this country, whether hopefully because of actual results, I would hope, right? They get the results. When you put those prices up against just a general hospital here for the same procedure, it could be twice as expensive for inferior results here. Why shouldn't, knock on wood, someone in my family close to me, because I'm going to be that person that they're going to call, or my wife who's a nurse, where should I go? 3 years ago, I couldn't have told you. There, ask your doctor.
Yeah.
And you talked about it before, and I'll ask you to verify this. A lot of people say, "Oh, I'm working with the best. He's the head of department at the hospital for orthopedists." That's like, I used to think that was the best surgeon or orthopedist, but now I'm thinking that's probably the biggest money maker for the hospital. Not necessarily getting the best results. I'm not going to label everybody, but that's the way business is.
There's a lot of that.
Yeah, I'm sure that there is. And we're coming up right up on an hour. Thank you so much. Is there anything you'd like to add? Any takeaways for employers?
I would encourage people to
info here.
Yeah, just go to either our website or Orriant.com, but even to learn about this aspirational healthcare movement, just go to aspirationalhealthcare.com. You can learn all about the NUCA model up in Alaska. We put on conferences. We load up all of the speakers' presentations on that website. There's tons of content about how you do healthcare around the customer and how employers can implement a healthcare benefit around the customer.
It's amazing. It's being intentional. That's why I talk about it all the time. If you want to do it, you can do it. Your current partnerships might be able to do it, but the consumer, which, as you mentioned, is under an employer-sponsored health plan, the consumer, the person making that benefit decision on behalf of all their members, is going to be the HR director or the CFO, the CEO. They just don't know what's out there. Ask tougher questions. You have to think about yourself as a consumer. And if you're not getting the answers from your current partners, you should look somewhere else. I'm not saying to call me.
And quite honestly, those partners, those advisors, those brokers that you're working with should be working for you.
Absolutely.
In most cases, they're being paid for and paid by the broken system. So
Right.
the first thing that employers have to do is shut that off, put them on a contract to be your consultant, and let their incentives and their bonuses be based on you accomplishing your business objectives.
Couldn't agree more. Well, thank you so much. This has been great. We did it. I wasn't sure at 1 o'clock if we were going to pull this off, but it was amazing. I don't know if you knew it was going to be an hour, but thank you so much. I know
It worked out great.
super
Thanks.
busy, but thank you. I'm going to end the broadcast, and please reach out to Darrell and I if you have any questions. Thanks a lot, everyone.
Thanks.